My name's David Barker. I'm the Chief Executive of Crohn's and Colitis UK, and it's an honour to be co-chair with Ian and Stuart here today because my belief as the Chief Executive of a patient organisation is that the work that is happening across the standards of which I chair that group, but also the audit and the registry are really critical in terms of driving up standards for patients, which is ultimately what we're all here for. So I'm not going to say a lot more. We've got a busy programme to get through with some really interesting speakers, so I'm going to hand straight over to Stuart Bloom, who's the chair of the IBD registry.
Thanks very much, David, and good afternoon to everyone. It's good to see so many of you here for an update on this combined symposium designed to highlight the interactions between the evolving IBD standards, the continuing IBD audit, and the IBD registry. As David says, we've got a packed programme. I'm only going to speak for a couple of minutes. I wanted just to highlight a couple of points to sort of provide a bit of a framework for you to think about during the presentations that are coming ahead, really. Many of you will know that we launched the registry formally a year ago, and I'm pleased to say that we're in a position to give you a look at some initial results from the centres that are actively entering data onto the registry. You'll find that there has not been a problem in engendering clinician enthusiasm and engagement. Most people involved in the care of IBD patients get what we're trying to do pretty quickly because it so obviously marries with the clinical importance and imperative of improving quality and capturing data at the point of contact. I'll not deny that there have been some challenges, and you'll pick this up during the symposium, that there are some hurdles in terms of trust administrations and IT departments, although I think we've made some progress in getting around this and in workarounds, and again, you'll hear some of this during the afternoon. I want to highlight the contribution that Richard Driscoll has made in addressing some of the IT governance issues at what has been a very difficult time because of the care.data problems associated with government and use of patient confidential information. And you'll see something of the way that we've struggled with, I think, successfully and worked around these issues. Fraser Cummins, who's our clinical lead, will give you an update on the results so far, and also what we're doing to thinking around the development of a web data entry portal to enable direct web-based access of data. Ian and Fraser are both going to demonstrate the evolving and very, very critical links between the registry and the IBD audit. And Fraser is also going to demonstrate something which we're quite excited about, and which has only just come up this week in terms of authorization and generation of the first set of results, which is use of registry enter data to provide linkage to HES data, and you'll see those results. Finally, it's always been a key aspect of the registry that we will identify patients suitable for research studies. Mark Baker's talk, I think, will illustrate the importance of this, as well as some aspects of what Fraser has to say. So I hope you'll find it a balanced presentation with lots to interest you, and I won't talk any more,